Hi everyone, it's Nurse Alda from Rejuvenation Clinic. For this young lady, we are going to do Kybella. Kybella is a deoxycholic acid. It's one of my favorite treatment for patients who have a healthy tissue, but they just have a little bit of a extra fat pad, whether it's for the submental, which is FDA approved, or if there's a little bit of a fat pad around the jowling or cheeks. Basically with deoxycholic acid, Kybella is the same enzyme as your body has, and it helps to break down the fat pad. I always use an example that imagine you have a little bit of a butter, and if you start pouring hot water on your butter, it will start melting the fat pad. We have to repeat this treatment at least 2 or 3 sessions. Also, we have to do an assessment. Everyone's submental fat is different, and also your skin quality is super important. Keep in mind that aging starts from top to bottom, and over a period of time, especially after age 30, our body starts losing collagen. So not only when it comes to the neck, submental fat is an area that everyone can struggle with. The excessive skin around the neck also can create a heaviness around the lower face. So be mindful, anything non-surgical takes some sessions, 2 or 3 sessions. Removing the fat pad, it's super important, but also focusing on maintaining the skin quality, it's very important. One of the laser devices out there in the market is Morpheus 8, and we can get to that later, but it's always a combination of treatment. So for this young lady, we're doing just 1 vial. Keep in mind, 1 vial is about 2 ml. When we're doing a submental, during the assessment, you always want to make sure you have your patient to look down. And during the facelift, or whether it's a liposuction for the neck, your surgeon would not only focus on the submental fat, they always will do liposuction when it comes to your entire neck. So keep in mind that everyone's different. Some patients have a very heavy submental fat, but some patients also have fat pad that it goes all the way back to the neck. For my patient, one of her concerns is when she's smiling, go ahead and smile for me. She does have such a beautiful cheekbone. She has such a beautiful smile, but usually over a period of time, when we gain a little bit of a weight, our lower cheeks becomes much heavier. And when the patient is smiling, it creates this heaviness in this region. So go ahead and relax for me. Turn this way. So this is our zygomatic bone. And for anyone that they know, this is where we put our makeup because we're trying to create more like a chiseled, sharp cheekbones. And when it comes to the mid-face, it's very important to have a little bit of a support because that's what gives us a support around our tear trough. However, when it comes to this area, which is the mid-cheek fat pad compartment, as we get older, this fat pad descends and it creates a heaviness around our nasolabial fold. So one thing I do for my patients, I have them to smile, I do a quick assessment, and what I'll do for them, I get rid of this little heaviness around the lower cheeks. So go ahead and smile one more time. Relax for me, perfect. So we're just gonna start with 1 vial. Go ahead and smile for me. More, and relax please. Awesome. So as I mentioned, the cheek fat pads are something that we don't want to get rid of. But when it comes to the lower face, unfortunately, the fat pad has a behavior of descending and it will create a heaviness on the nasolabial fold. So in order to provide comfort for patient, I always mix a little bit of a lidocaine, 0.1 or 0.2, 1% lidocaine. And that will provide comfort, and also as we're injecting the patient, it creates some burning sensation. The lidocaine will subside that feeling. So as I said, we're going to focus on the area that when she's smiling, it creates more like a fullness, and it makes the patient look more full than they are. So, alrighty, go ahead and turn this way. Injection is going to be 0.2 as we're going more towards from lateral to medial. One of the assessments we can do is when we have the patient to open their mouth, go ahead and open your mouth, we can go ahead and feel the fat pad in this region. And there's not much any artery or nerve runs in this area, so we should be pretty safe. All right, so 0.2, 0.2, and we work our way, as I said, from lateral to medial. You have to educate your patient that Kybella inflammation, the peak of inflammation is always 24 hours after the injury. I educate the patient that we shouldn't put any ice because, as we know, ice can slow down the inflammation. And this is the only treatment that I do want my patient to have inflammation. Kybella is going to start melting the fat pad, and it's your lymphatic drainage that will get rid of that fat that it has turned from solid to liquid. So go ahead, turn this way for me. Again, if you do a quick assessment, open your mouth. Right there, we can feel all the medial cheek fat pad. It's more like a deep fat compartment. So you want to be at least 1 millimeter depth to the fat pad. You can even feel it with your needle, because when you go through the skin, you can totally have a feeling, different feeling, versus when you are going to inject in a fat pad, because it feels very soft and cushiony. 0.2, small amount of injection, so we can go ahead and kind of like distribute the medication equally to that region. Go ahead and smile for me for a second. Yeah, it's very easy to not miss it, because as the patient smiles, the fat pad shifts forward. This is why in pictures, a lot of women, when they want to take selfies, they create this motion, because what they're trying to do is by pulling the muscle inward, by pulling the masseter muscle inward to creating more like chisel look, and also they're trying to kind of accentuate the chin and jawline. Your lower face is super important. That's why I always suggest that if you don't have a strong chin, it's so important to either use a chin implant, seeing a facial plastic surgeon, or by injecting fillers that has a higher G prime, like Radius or Voluma or Restylane Live, to create that chin and jawline. Keep in mind, patients shouldn't be icing. The one thing they can do is using some pineapple. Pineapple has an enzyme that it will help with healing process. I will have my patient to come back in 8 weeks. We can do a quick assessment, and based on the improvement that they have received, perhaps we may need to do a second session. This is a very small area, therefore 1 vial is pretty enough for that area. However, if we're trying to treat the submental fat based on the facial anatomy of the patient, we may choose between 2 or 3 vials. Well, thank you for watching this video. Please don't forget to subscribe and like, and hopefully we'll see you on the next video. Thank you.